All right, so if you look on the agenda, I'm going to give you the administrative perspective, and then I'm going to have Chris go into the details. But I think when we did the introductions, I don't know if Chris got a chance to say hello. I just want people to know who's in the room. So, did we miss anybody else, or everybody had a chance to say hello? Great, great. Okay, so I think we're pretty much right on time. Okay, great. Well, let me start off by saying, let's talk about that word, evaluation. I want you to think about that. How do you feel about that? Think about you're going to be evaluated, or you have to evaluate someone else, or a program's going to be evaluated. Just at your table, talk a little bit. Evaluation, what connotations there? What do you think of? Because we're going to be talking about evaluations. Go ahead at your tables, just chat a minute about that word, evaluation. How do you feel about it? Raise your hand if you want a little more time. Anybody need more time? Okay, Sally's going to help with the mic. And the question is, how do you feel about that term evaluation, whether you're being evaluated or you have to evaluate something? Are you comfortable with it? Do you like it? I like it, but I'm just curious. It's kind of like public speaking. So anybody want to comment about that? There's no right or wrong answer here. Any comment?
So sweaty palms came up. You have to look backwards before you can look forward. We have a brand new employee here right out of nursing school, and she said it's the E in the pie as far as the nursing process. You evaluate.
So what causes sweaty palms?
Possibility of the negativity. I did something wrong. What? Not me. I never do anything wrong. We all do. But you want to see what you did wrong so you can improve upon it.
All right, great.
Okay.
The word evaluation evokes generally negative feelings.
Okay.
Because you think of you being evaluated or evaluating somebody else, and generally negative kinds of things come up.
Okay. So you all came anyway. Good. All right.
All right. Comments here. Anyone?
Thank you.
I think that you think of judgment. So you feel like you're going to be judged and nobody wants to be judged negatively.
I'm noticing a pattern. It's all about fear of the negative. Nobody's mentioned that. It can point out all the great
I'm going to
things
get to that.
that are going on.
Well, you get that at this table, because what we talked about was it gives us an opportunity to improve. So evaluation can be beneficial.
Thank you. All right, great. Thank you.
Good. That was a nice
Hang on. Did you
note
want
to
to make
end
another
on.
comment?
Oh, another one. Go ahead.
Yeah, my simple response is, I hate being evaluated. I love to evaluate others. But we had a nurse at one point at Saddleback College who became the director of nursing, and then the dean of health sciences, and then the president of the college. And actually, after she retired, she came back and became acting chancellor. And I worked with her for a while. We were both deans at the same time. And after she became president, I went into her office and asked her how she was doing. That can be a thankless job at times. And she said she was doing fine, and I said, can you separate your work from going home? And she said, absolutely. And she said, it's real easy. She said, I just go back and I use the nursing process in everything that's presented to me as college president. And then I learned a little bit more about the nursing process and where evaluation comes into that. After you've made a decision, you sit back and reflect on it. And I really I've always felt a lot better about the word evaluation after hearing that.
So, positives and not so.
Okay. Do we have another comment?
Opportunity for growth, really. It can be.
Great.
Okay.
Thank you.
Well, the purpose of my talk is to put a positive spin on evaluation, but I'm also going to talk as an administrator. We're going to focus on how we evaluated mental health services. We do other services too, but this is kind of a concrete example of what we did. But I want to take a moment and step back and put it in the big perspective. And I'm going to go way to the top and talk about why are we doing evaluation at all, and how does it fit into the bigger picture. When I'm talking bigger picture, how many of you have heard of the student success? Okay, this is something relatively new for community colleges. And when you think about student success, we're holding students accountable, we're evaluating their success, but also colleges are being evaluated. How are we doing? And when you look at a college, you're going to look at the teaching, the faculty, the curriculum, but we're also going to look at student support services. How do we contribute to student success? So I'd like to talk about that in these bigger global terms, because I think it's important to understand when we're in the trenches providing services to students, how does that relate to your division, your department, your college, your district, the state goals? Because it's important for us to connect our work. I know that we do good work. I know that we help students every day. I think it's important, though, for us to know the lingo and the language and the thoughts and how other people are going to evaluate. If you're a manager, you're familiar with the program review and the management goals and the budget and things like that. What the manager does is you represent your department and you try and interface your department with the rest of the division, with the rest of the college, and you try and line up with the goals of the college. It's a very important job. The people that are actually providing the service to the students, that's important too, but it needs somebody to take that and interpret it to the rest of the college and interpret the outside world back to the health center. So that's kind of a management role. So we try and connect the dots between this idea of student success and evaluation. And then today we're going to get into the nitty-gritty of how we actually did evaluation at the health center. But let me elaborate a little bit further about the big picture. I mentioned the Student Success Initiative. How many have heard of the scorecard for community colleges? All right, this is going to be a new measure of how colleges are going to be looked at. All right, it's going to be public information on the website. Of course, accreditation is another measure of evaluation for colleges. How many have heard of student learning objectives? Raise your hand. Okay. How many of you have student learning objectives in your health center or in your department? Okay. A real simple way to look at that is, whether you're teaching or a class, or whether you have a goal for students in your department is, number one, what do you want students to know? What do you want them to be able to do? And thirdly, how are you going to measure that they're able to do it? It's kind of a simple way to look at it, but we could take that in student health and say, well, we want students to know about the health center. What do we want them to do? We want them to use the health center. And how do we know they do that? Well, we count numbers. How many came in? How many did we serve? That's a simple example of a student learning objective for a support service area. Okay, there could be others. But again, this is the language that education speaks. Many of us work in healthcare or mental health. We're kind of in the education world. We're kind of a little bit different than the setting we work in. And because of that, we have to be able to cross those barriers, break down those silos, and connect with the education world. All right? So again, this is big picture. Some other goals that they're looking at, they use the term persistence and retention. How many have heard of that? These are things that the scorecard's going to look at. In other words, do our students stay in school? Do they drop out? I always use the example is I look at the parking lot at the beginning of the semester and you can't find a parking space. Towards the end of the semester, no problem. Where did all those students go? I'd say about a third of them drop out. I used to teach and I'd see my classes, students would drop out. And I believe that part of the dropout, retention, or persistence, it's not just the academic side. Absolutely, we need good faculty, good curriculum, we need great programs. But we also need to support our students. There's the non-academic issues that sometimes get in the way and are the barriers to student success. And most of us here today, that's what we're about. And so we're going to, again, look in detail about that. How many of you have a committee at your college that's maybe called the enrollment management or recruitment retention committee? In other words, some kind of committee about student success. Maybe you call it something else. Do you have a committee like that? Okay, so that's Saddleback over there. I'm sure your college has some program about student success. I would encourage you as someone who works in student support, get involved. All right? Again, most of the focus is on the academic or enrollment management, things like that. Every student should have a student education plan, and students with certain credits should have priority. Those are all important things, but again, people in student support need a mechanism to get to the table and to be able to say, we contribute to student success as well by providing these support services. You know, when you think of the community college student versus the UC, the Cal State, or the private, we know that our students have less resources than those other students. And even more so, they need student support to be successful. So again, I think our role is critical, but we do have to get to the table to advocate for those students and those needs. You know, as I'm thinking about the student supports, you know, it's not just health service or psychological services, it's M&O, maintenance and operation, it's the IT, it's disabled students, it's the business office, it's admissions and records. A college like this can't operate without those support services. Now, some of these areas might be more challenged to try and connect some kind of data to show how they contribute. I'm going to share with you some specific tools that I hope you will try to use, because it's all about the data. In fact, when we were at the managers meeting here at Golden West College, our president encouraged us to do data-driven decision-making. And I stuck up my hand at the meeting and said, well, I have an example, and I invited him and other managers to come. So be careful what you say, because your president may come to hear what you have to do. So I'm thrilled that you're here. So getting to the idea of data, well, think about your service. How would you measure that? How would you connect that to student success? I'm going to give you an example. In fact, one of the handouts is this sheet, and it's called, it says draft, and it's got my name, Rob Bachman, Golden West, but it says Student Success Score. So I'm going to talk to you about this, and by the way, it's also on our website. You can get a copy there, so you can mark this one up. In fact, I'm going to encourage you to take this as if you were a student. But let me tell you, this is why I created this. I don't think anything like this exists, but right now there's a challenge for health services to somehow get a measure or some data on how we make a difference. So I thought of the idea, if we could get students at enrollment to fill out a form like this and give us a number, a score, we could rank them in terms of their needs. So if you look at this more closely, there's 20 items. I tried to capture the needs, the things that would interfere with students completing their courses at school. And I say rank these on a scale of 1 to 5. 5 means you're very strong in this area. 1 is you need some help. And then you'd get a score on a 1 to 100. And if you scored closer to 100, we know your needs are fairly well met. But let's say you only scored to 50. And let's say we identified that you had problems with sleep and with housing and relationships. That would then identify needs that you have. And we could also say, here's some resources to help you in those areas. It gives us a baseline measure. So if every student knew their student success score, and if they scored low, they could identify areas of need, and they'd also be told about resources either on the campus or in the community. We could plug in those resources. The hypothesis is the higher your success score, the more likely you would succeed. So here we have the hypothesis, we have some scores, we have some data. We can test that, we can measure that. And we can also say a student might have had a score of 50, but after we intervened, we raised it to a 75. And we could hopefully correlate that with school success, like their GPA. Did they stay in school? Did they graduate? All right. So in other words, it's something measurable. And so you could do this at enrollment, and I would say you do frequent assessment later, maybe once a semester. You could also do it when they leave. Another part of this is in my division, Janet Houlihan is our vice president, we would like to do an exit interview. We want to know when students drop out, why. So we want to ask some questions why they did, and then that'll help us identify needs. So what I'm trying to tell you is we need to measure. We need to get some data that we can compare and have a baseline. So I'd like to ask if there's a question, and then if not, I'd like you to just to try and complete this and see what your score is. Students do it in about 2 to 3 minutes, so I'm not challenging you to see if you can do it faster. But first of all, is there a question about anything I've said so far? I know you're all dazzled. This is great. I'll give you a minute here. I'll give it that moment to respond. Now, I realize this has never been seen before, so anybody have a question about the idea of having a tool to get some data to establish a baseline that we can use to show that your service makes a difference? Yes. And we're getting the microphone.
I do love the idea of having data to really show how we are servicing students. My question is around, like, how do you collect? Like, do you ask students to take this when they enter the college or when they come in for service? Or, like, how is it disseminated?
Okay. The logistics, okay. My idea, now understand we've never done this, but my plan is students enroll online. And we ask students to do many things when they enroll. I'd like them to complete this, all right? If it takes them 2 minutes, great. Then we have that data right there electronically. And also while they take it, my dream is that if they score low in an area, they'll get a message saying, you know, you might benefit from this resource. Did you know there's a health center? The reason I mention this, when I talk to students in classes, about 75% of them don't realize about our services. They pay the health fee, but they don't really know what they get. So this would alert every student when they start about the services. So I would have them do it right at enrollment. When they enroll, they do it online. So that's how I would like to do it. I would love it if every professor would, at the beginning of their class, have students do it, to, you know, because this number could change. You could be I'll give you this example. You could be a 4.0 student, and then suddenly your fiance breaks up with you, and now you're a basket case, and now you're having a hard time making a C. So things could change up and down. So frequent assessment is important. So at enrollment, maybe during the semester, or any other time someone comes in for help, or certainly at the end. Again, it gives us a number and some data. Of course, this has to be reliable and valid. A question over here. Yes, go ahead.
I have a question regarding collecting data and doing research like this. One of the things that just popped into my head was usually we have to have a consent to participate in research. And then usually we have to determine, you know, through like an IRB board or something like that, what the level of harm might be in engaging in the research. And I was wondering if any of that is built into this type of data collection.
It sounds like you're talking about the Institutional Research Review Board, and each college has a mechanism to do that. We have a person named Kay Nguyen who does a lot of that for us. I've shared this tool with her. Again, this is very much a draft, but I agree with you. We'd have to, because you know what? A lot of other people want to survey students on campus, and I have to get in line. And of course, it would have to be approved. I think probably starting with a pilot project, getting some data saying, hey, look what we've got here. Here's how we're using it. This is going to take time. I share this with you with the hopes to inspire you to maybe take that tool and make it better, or to try it yourself and see if it goes. But all of us are going to need some kind of measurement, some kind of baseline, some kind of number how we can compare. But yes, you raised a logistical challenge. How do we get it approved? How do we get in line? Thank you. Anything else about the tool? Did anybody have a chance to finish it? Did anybody get their score? I won't ask you to share your score, but I'll make a prediction that almost all of you scored low in sleep. Because when I asked about 20 students, and they all get less than 8 hours of sleep. And sleep is so important to your health. You know, so I'm guessing a lot of you didn't do well in sleep. Let's get some more comments here. Yes?
Is the intention to tag the student with this and follow up with them specifically, or are you just gathering general information and then besides the student having their own little tool?
The question is, am I looking for general information, or do I want to actually help that particular student? The answer is yes to both. I'd like to collect some general data, but I also want to make this a valuable tool to help you, or help you, whoever filled it out. So it could be used both ways. Speaking of data, there's a couple of other really important data sources. I'll mention this. How many have heard of the National College Health Assessment? Okay, this is national data about college health needs. We've been doing this here at community colleges now for a number of years. We did one at Golden West this last spring. We have data there that show that over 50% of students at some time during the semester feel like giving up. Right? This relates to mental health. 33% of them feel so bad that they don't feel they can go to class. 10% of them feel suicidal at some time during the semester. That's huge mental health needs. We know that stress is the #1 health issue students face that come in. They come in for lots of things, but mental health and stress is huge. All right, so there's some data there. We also have the Health Services Association California Community Colleges has an annual report where we have some data. So we do have some data, but each of us is going to be challenged in our department to demonstrate how we contribute. We're going to need some kind of tool. Teachers have test grades, okay? They have grades they hand out to students. What do we have? So I'm proposing this as a mechanism, so to help the individual student, but also to demonstrate the value of a program or to make a data-driven decision. Do I need more counseling hours? Why would I do that? Okay, so I would use data. So I've been talking in the big picture. What I'd like to do now is take a couple minutes and talk about some very specific things about what we did at mental health at Golden West College. But before I do that, I just want to give anybody else a question about the big picture. Anything at all? Are you guys all excited about connecting to the big picture, student success? Okay. No, seriously. Yeah, come on, guys. Okay, great. All right, let's see if I left out anything about that before I leave. Well, let me give you a couple other examples about big picture things. One of my other roles is I'm the state president of the Health Services Association California Community Colleges. And this summer I got a call from Peter Lee, who's in charge of Covered California. How many heard of Covered California? Obamacare. Okay, now regardless of your politics, it is the law, and one of their challenges, they need to sign up people. And who do they need to sign up? Young, healthy people. So they went to the chancellor's office at the state and said, maybe community colleges could be a place we could sign students up. So they called us up and they said, how many students have health insurance? Data. So that was hard to get that data. But we scurried around, we talked to different people, and we came up with an estimate that, depending on which college it is, anywhere from 20 to 40% of students do not have health insurance. All right? So there's an example where major efforts and programs are asking us for data. So again, collecting data is important. Another example is, and Jeannie just went to this, we got a call, how many homeless students do we have? Well, I didn't have that number out in the fingertips, but I looked back at the National College Health Assessment where we surveyed 500 students, and based on that, 4.8% students at Golden West College are homeless. And I think at Orange Coast College it was maybe 3%, and it varies from college to college. And Jeannie, I know you just gave a report on it. You just want to comment on that for a minute? I didn't mean to put you on the spot, but I did. You want to just say, you testified, didn't you, just up at the state?
This week I had the opportunity to testify at the assembly hearing at the Capitol regarding the non-academic barriers to student success and homelessness being a big one. Across the states from north to south, our average is about 4% of our students are homeless, and that is the students who are couch surfing, sleeping in their cars. And they don't typically identify as a homeless student because they look at homelessness as people on the streets or in parks. So they are hesitant to go to our social service offices because they don't really identify. But we're seeing an increase across the state on homelessness, and it's definitely a barrier to student success.
Thank you, Jeannie, for sharing that. So again, here's some examples where people are asking us for data. And again, data is so important. If there aren't any questions there, I'd like to turn now to what we did to evaluate mental health services at Golden West College. And my colleague, Dr. Kleinpeter, will get into more details, but I just want to give you, as an administrator, why we did this. Well, to start off, we knew that mental health needs were significant for those data that I shared with you. We knew stress was the #1 issue. So we started asking questions. We said, well, what are the needs of students? And we knew stress was important. We said, how many seek mental health services? How did they enter the system? We started counting how many students came. And then we looked at who provides those services. And then what do we provide? What actually happens during the counseling session? And then we started to look at outcomes. And how did we do that? We actually read the charts. We went back and did an audit. Now, we read every chart. You might say, oh my gosh, I can't do that. But let me just tell you our experience, and I'll give you some ways to go too. Now, I will say that a huge part of this success is sitting right over there. So the first thing you need to do is find a Dr. Christine Kleinpeter. And let me clarify that. She mentioned she's a professor at Cal State Long Beach, and she's also a licensed clinical psychologist, and she likes to publish research because where she works, it's publish or perish. So what you do is you find somebody who has to publish research, who wants to do research, and they're a good match, and that helps you. Now, not everybody has to publish research, don't get me wrong. In fact, there isn't a lot of research on this topic, but everybody can start to collect some data. So even if you're not going to publish it, you can start to count those things I mentioned, all right? And I will guarantee you this. You might say, oh, that's a lot of work. I guarantee you if you start to count and look at things, it's going to get you excited about what you're doing because you're going to go, oh, I had no idea. And then I'll also share with you as a manager, your team gets excited and they start talking to each other. And then you start talking to other departments. There's a tendency for people to work in silos. You know, the health services, even if you teach English, you know, it's your class, you don't tend to interact as much. So when you start to have some data, you start to talk to other people, other departments, it gives you talking points. And there's a synergism that happens when people see movement in that data, when they can say, wow, that made a difference. So from a manager's standpoint, using data to make decisions is really important. And it's also important for staff morale because they see evidence that these things work. So let me give you some very specifics, and then I'm going to turn it over to Chris. Like, for instance, what did we look at Golden West College? Well, I mentioned we read every chart, and we looked at who provided the services. And then we looked at what are the best practices. And one of the best practices we know is cognitive behavioral therapy. It's a type of therapy. It works very well at short-term acute care. And then I looked at the providers I had and what type of therapy they did. And we made some changes. And we shifted to everybody doing cognitive behavioral therapy. All right? And since we've done that, we've seen different results. So we had changes in personnel who aligned with the goals of what we do in therapy. And then we looked at what I was really concerned about is we only have 8 visits with students. I wanted that first visit to connect with the student, to identify some goals, a diagnosis, and give the student some homework so that they're motivated to come back next time. So all our counselors agreed to do that. We also looked at some other very specific things, and Chris is going to go into more detail, but we looked at motivational interviewing, a technique to get the patient to follow up. And that started at the front desk. It started with the nurse doing the intake. All of them received training in motivational interviewing, and we found good results that when we did this, patients started to keep their appointments. Here's another thing you count. Well, how many come for help, but how many keep their appointment, and how many stay in therapy? And by doing these kinds of things, we improved on all those numbers, and Chris will tell you more about that. So I mentioned cognitive behavioral therapy, motivational interviewing. We also did satisfaction surveys, and I think we had data that said patient satisfaction was, 97%? A very high number, all right? So they got something out of the therapy sessions. We also did something on coping skills. We measured coping skills. We did alliance with the therapist. These are all examples of best practices that we implemented to make a difference in the patients when we saw them. And then we also did the PHQ-9, and we did it to every student who came in, even if it was a sore throat. And I think we found about 15 to 20% of students who came in with a medical problem also had a mental health problem. So these are some really exciting measurements and data and results, and I'm going to let Chris go into detail, but those are some highlights of what we've done. Now, we also tried to connect it with student success. We looked at transcripts, we looked at their GPA, how many stayed in school, how many actually graduated, and that data still needs to be looked at, but we want to see that those students that we help, did they stay in school and were they more successful? And again, going back to that student success score, these types of things, we hope to have some measurable data. I also want to let you know that we have copies of the abstracts of the 3 published articles. It's on our website, and our 4th article is soon to be published, and we're working on our 5th. So we'd like to share that information with you. And I also want to say, just because that worked for us, it may not work for you. You might have different resources, but everybody can start to count and start to look at data and trying to get a baseline of data. So I hope you feel, you may not want to publish, but I hope you feel encouraged, like this is doable, and I hope you feel excited about looking at this and measuring it. Later, I'm going to put my staff on the spot and maybe ask them, what does it mean to me as a nurse or a front office person? And I hope they're going to say positive things, because I see positive things in our staff meeting. For instance, we talk about cases, we talk about systems and processes, and I believe they feel included in that success because they have a part. They're the first front desk, first person to meet the patient when they come in for mental health. Remember the stigma? So they do motivational interviewing. Then they see the nurse, and the nurse does motivational interviewing. And then by then, when they see the therapist, that person's well primed and ready to go. So I've got 5 minutes. Okay, great. Actually, I'm about ready to wrap it up. So I warned you guys, I might ask you to comment. I told you that ahead of time. It's all good. Are there any questions for me? Otherwise, I'm going to let Chris go up. Anything at all? Any comments about some of the things I've said? You may not agree with me. That's okay. We can have a discussion. But do you feel better about that term evaluation? Give me a thumbs up. Yes? Anybody? Okay, got a few. Anything at all? Any comments, suggestions? Or maybe anybody want to share what they've done? Oh, the mic is going around. Yes, Rose.
Yes, I just have one quick question. From the time you are planning to have this data collection and launching this, I just want to know the logistics. How long would it take you, or how long would it take you? From involving your staff, coming up with a questionnaire, giving it out to, are you not disseminating this to the whole professors, the teachers and all that, or is this just within the health services, the student services?
Now, are we talking about the student success score or those other things that we've done?
The questionnaire that you have here, the tool.
That?
It's really great. I already talked about this with my dean, and he's also promoting this one. So my question is logistics-wise. How long did it take you to come up with this questionnaire, involve your staff, and then are you now involving the whole teachers or the whole student whole campus yet?
So this was not an overnight or weekend thing. It's really been over 4 years. And it started from simply counting. How many people come in? How many keep their appointments? And then we said, well, we should look at the charts. I'll tell you, as a manager, when you have mental health services, you assume everybody's doing their job, and then you get called in when there's a problem, usually. So I encourage managers to look deeper, to not just respond to when there's a problem, but also look and then say, wow, that was great, let's continue that, or hey, maybe we can improve there. So this was an ongoing process of 4 years. This evolved. What you're seeing is a lot of hard work by everybody over 4 years. Now that student success score, I've been thinking about that for 5 years. Okay, so it takes a while to evolve, but you got to start somewhere. It's a long journey, and you start with the first step. So I hope, did that help a little bit? Okay. Anything else, or otherwise I'll give it over to Christine. Yes?
I can just shout. I'm old and sometimes live in a silo. And I'm tempted to get my cell phone out and Siri motivational interview.
Okay.
Is that a term that has a definition and tools behind it?
He asked about motivation and everything. Chris will, as a psychologist, will address that as soon as she's up, but we will do that, yes. That is one of the best practices, and you can train it to all your staff. Front office had it. It's a way to, well, I'll let Chris explain it, but thank you for asking. Were there any other specific questions? Okay, our plan is Chris is going to give you the details as the clinical expert. I might interject and I might ask some staff. Chris is kind of work the crowd, and I think she's got some interactive things for them to do as well. Okay, so if you didn't get a chance to speak up earlier, you'll get another chance. All right, thanks for listening, and Chris Kleinpeter, you're on.
Thank you.